Dosage. Dose here too, as with other drugs, has a double meaning. It refers to the daily allowance of DD water, but it also defines its deconcentration and the active agent content of the preparation. It is desirable that the patient drink at least 75 to 80% of his daily water intake in the form of DD water. An occasional broth made with normal water or a limited consumption of fruit and vegetables is allowed, but we do not recommend the consumption of tea, milk, wine, beer, fruit juice, or other liquid in great quantities. Tea can be prepared with DD water as well. We also recommend that after consuming food of a normal D content, the patients drink DD water to keep the mean deconcentration of meals below the normal level. It is easy to see that just like with other medications, the dose can be raised in two ways: by increasing the daily amount of DD water or by lowering its deconcentration, that is, increasing the active factor content. Dosage must be determined individually, according to the patient's condition. In general, it can be stated that there should be a minimal 50 to 60 parts per million difference between the deconcentration of the patient's body and that of the DD water to be consumed. The prescription, thus, should contain two numbers, the first referring to the volume L, and the second to the deconcentration of the preparation ppm. Experience is with 90 to 95 ppm DD water theoretical calculations. Until the application, 25 parts per million DD water. The dosage was based on experiments carried out with dogs and cats until the summer of 1998, as well as on the effective dosage of DD water used during the Phase 2 clinical trial and adjuvant therapy. With these experiments, we arrived at a range of 0.014 to 0.026 kilograms DD water/body mass kilogram per day. Applying DD water with a concentration of 90 to 95 parts per million. Considering this wide range, a further division was necessary. Table 11.5 shows that by taking two extremes and one middle value, the starting dose of DD water was established as a function of the body mass. Taking the above doses into consideration, we will demonstrate with some examples the theoretically established deconcentration in the human body after the consumption of DD water. In the calculations, we assume that the water content of the human body is approximately 60%. The deconcentration applied is 95 ppm, and the deconcentration of the water content of the body at the beginning of treatment is 150 ppm. Taking into account our results when we determined the deconcentration of the serum of a dog having consumed DD water as drinking water, of the deconcentration in the urine of the patients, we can say that approximately 50% of the theoretically calculated deconcentration could be realized. This means that the results of the theoretical calculations concerning the changes in the daily deconcentration values will be released only in 50%. This is also true for the diminishing total deconcentration due to the long-range DD water consumption. From the examples, we can see that the three dosage schemes differ from one another, especially at the beginning of the treatment. As the treatment goes on, there will be an alteration in the obtainable absolute reduction of the deconcentration. Nevertheless, the change in the daily deconcentration is almost the same in the three cases. As mentioned before, one of the aims of dosage is to keep the daily deconcentration change at a constant level. Here you can find an example how an increase in the interim dose can influence changes in the daily deconcentration. In Table 11. 6. It can be observed that the change in deconcentration after 29 to 30 days of DD water consumption is only 0.45 ppm if the patient consumes the DD water according to the DDWA scheme. However, if we put the patient on the 3011 day from the DDWA scheme to the DDWB, and from this time on he will drink 1 liter of DD water daily, Theoretically, there will be a 1.1 ppm of deconcentration decrease on the first day, and this is almost equal to the reduction of deconcentration established at the beginning of the treatment. Table 11.5 dose regimen with 90 to 95 ppd water as a function of body mass and 3 different doses related to 1 kilogram of body mass. Calculating the dose when applying 25 ppm DD water. In the new era, the application of DD water of a 25 parts per million D content enabled us to establish a more effective dosage regimen. We diluted DD water, adding normal water to it, depending on the state of the patient, the tumor type, the duration of the treatment, etc. Our recommendations as to what D content the applied water should have will be dealt with later. In Table 11.7, the D content of the water is given if it is diluted with various mixing rates. The final concentration of a given mixture, knowing the D concentration of its 2 components, can be calculated with the help of the formula below. VXC plus V. XC equals sine V plus VXC, where C equals sine the deconcentration of one component in ppm. C equals sine the deconcentration of the other component in ppm. Equals sine the amount of one component in liters. Equals the amount of the other component in liters. C equals sine the final concentration of the mixture in ppm. Since C, CV, and V are known quantities, after performing the operation we get the value of C, that is the final concentration of the mixture. By applying the above formula, we may also define how the deconcentration in the patient's body changes subsequent to consuming DD water. Example: if a patient with a body mass of 70 kilograms on the first day of the cure drinks VJ 1.4 liters of 87.5 parts per million DD water, C equals sine 87.5 ppm. That is 25 parts per million water mixed with normal water in a 1-to-1 ratio. The theoretical decrease of the deconcentration can be calculated as follows. We suppose that 60% of the patient's body is made up of water, or the deconcentration of which C is 150 ppm. Thus 1.4 liters of DD water V are diluted by 42 liters Vi equals sine 0.6x 70 kilograms of normal water. 42x 150 plus 1.4x 87.5 equals sine 42 plus 1.4. 6,300 plus 122.5 equals sine 43.4 xc. 6,422.5 equals sine 43.5 xc. 6,422.5. 43.5 equals sine c. 147.64 equals sine c. This calculation shows that by the end of the first day, the deconcentration of the water in the patient's body will be theoretically 2.4 ppm lower. As stated previously, it is only about 50% of the theoretical value that can be realized. In our case, this means that by the end of the first day, deconcentration will be approx. 1.2 ppm lower. Table 11.7. The deconcentration of DD water gained by mixing 25 parts per million DD water and 150 parts per million normal water. Factors influencing the determination of dosage. 1. The volume of DD water consumed. Based on many years of experience, it became obvious that there is a clear-cut connection between the volume of the DD water consumed and its efficacy. The more DD water is consumed with the less deconcentration, the greater the decrease of deconcentration in the patient's body, thus the stronger the effect. It is very important that the dose should be established accurately, so that the patient drinks enough DD water to get the necessary effect. At the same time, it is important to keep the decreased deconcentration in the body as long as possible. 2. The concentration of DD water. The lower the deconcentration of the applied water, the greater the effect from the consumption of 1 unit of DD water. However, It does not follow from this that the patient should be given water of a low 30 ppmd concentration right at the beginning of the treatment. 3. The reaction of the patient to the administration of DD water. Based on experience gained during the last years, it can be stated that DD water is not toxic. It does not cause any destruction in the blood count or in the mucous membrane. It does not cause nausea, etc. DD water is consumed by a healthy person or by a patient in total remission. There are no observable side effects of consumption, but there can be some subjective and objective side effects of drinking DD water by a tumor patient. These effects are caused by the interaction of DD water and the tumor. Therefore, it is the physician's task to follow both direct and side effects of DD water. One of the most typical side effects is the appearance of drowsiness and fatigue within 1 or 2 weeks, or in some cases later. The drowsiness and fatigue disappear after some weeks, depending on other parameters too. When the dosage is established, it is most important to consider the strength of the reaction, and should it be too strong, the daily dose must be reduced by 10 to 20%. It is not advisable to interrupt the consumption of DD water, because this will make it easier for the tumor to get used to the DD water medium. If the patient no longer feels side effects or feels that the effects have become weaker, then the dose must be increased to the original level. Naturally, the opposite of the above may also happen, namely when there is no effect at all. The application of DD water has no perceivable effect within a month. A more significant 40 to 50% increase of the dose should be implemented, which means either the increase of the volume of DD water or the administration of a preparation with a D content lower by 10 to 15 parts per million. It is important to stress that hypersomnia or fatigue appears mostly in an advanced condition and in the presence of a relatively large tumor, 3 to 6 cm in diameter. The tumor is of a smaller size. The above symptoms may not appear at all. 4. The body mass of the patient. Children are the most ideal subjects, because a relatively large dose can be administered on account of their relatively small body mass. The application 85 to 90 parts per million DD water is considered. We can say that up to an average weight of 60 to 70 kilograms. The daily fluid requirement and the recommended daily dose of DD water are in accordance with each other. It is more difficult to remain within the limits of the daily fluid need of patients within the 80 to 100 kilograms range. So, for them it is by all means necessary to drink DD water of a lower D concentration so that the established dose can be kept for a longer period of time. 5. Types of tumors and their sensitivity to deuterium depletion. From our experience, and according to expectations, it can unanimously be stated that tumors of different origin of those belonging to different classes do not have the same degree of sensitivity to deuterium depletion. Based on our data, we established a scale of sensitivity, which, of course, may change with the information we will obtain from more patients with different types of tumors. The types of tumors in relation to their sensitivity can be seen in Table F. 8. Additional criteria in connection with the sensitivity of the tumors are defined below, from among which one or more may be characteristic of a given tumor type. Types with high sensitivity DD water prove to be effective in 70 to 80% of patients, in quite a lot of patients 30 to 60. In some cases, tumor regression became evident within a few weeks. We succeeded in stopping or reversing progression of the disease even in its most hopeless state. The effect was quick and obvious with some classes of tumors, where we had data of a few patients, only 10 to 50. DD water did not only prolong the life of the patients, but it resulted in obvious tumor regression and remission. Types with average sensitivity in cases where the volume of the tumor was not significant, less than 3 to 4 cm in diameter. The effect of DD water was proved without doubt by the regression of the tumor. On the effect of DD water consumption, the progression of the disease was stopped with patients in the late stage of the illness. Types with less sensitivity. From among several tumors of the same type, only some patients showed a positive reaction. Regression did not occur. We only succeeded in stopping tumor growth. Resistant tumors. In these types, there are no cases where the efficacy of deuterium depletion can be confirmed. We know, however, that these types of tumors have been encountered only rarely. We had some patients with other tumor types, too. So far, we are unable to make any statement concerning the sensitivity of these types. They are considered to be more or less sensitive to DD water, but the small number of cases makes it impossible to establish an exact classification. Such are tumors of the hard palate, pharynx, esophagus, bone, various types of sarcomas of the soft tissue, neuroblastoma, etc. Table 11.8 Sensitivity of different tumors types to deuterium depletion. Experience based on relatively few cases 2 to 10. The higher degree of sensitivity may be due to the direct contact of the tumor with DD water. 6. Total mass of the tumor. Here too, the relation is obvious. The smaller the mass of the tumor, the higher the efficacy of DD water. During the establishment of the dosage, a small mass of tumor means that a lower dose may be enough to reach regression. And at the same time, the necrosis of a smaller mass of tumor does not burden the body so much. Thus, a dose larger than necessary can be applied at the beginning of the treatment. In case of an advanced stage, while establishing the dosage, besides the aim of keeping the efficacy, the long duration of DD water consumption must also be kept in mind. 7. The shape of the tumor. Our experience indicates that the part of the tumor which is in contact with the healthy tissues is the most sensitive to DD water. This may be explained to the fact that this is the most invasive area of the tumor, where the cells are in the most sensitive stage of cell division to deuterium depletion. Our experience has shown that during the regression of the tumor, the tentacles infiltrating the surrounding healthy tissues are retracted first. This may have an importance especially when, for example, the patient can be pre-treated with DD water before surgery. This pre-treatment may make the removal of the tumor easier and the patient more operable. Drinking DD water can especially be advised 2 to 4 months before the operation of brain tumors, if otherwise there are no contraindications. It is also characteristic that the tumors of a bigger expansion, for example the tumors of the pleural membrane, are much more responsive than those of a globular shape. 8. The localization of the tumor. From the point of view of the effect, the most ideal tumors are those which can get in direct contact with DD water. These are tumors of the stomach and the oral cavity, or tumors and metastases of tumors close to the skin surface. This is why 50 to 60% of the dosage based on body mass can be enough to be effective in the beginning of treating a patient with stomach cancer. In the case of tumors of the oral cavity, we suggest keeping the DD water in the mouth for a while, 5 liters a minute, if possible, before swallowing it, 5 to 7 times a day. We suggest applying DD water-based ointments or wet packs saturated with DD water for the treatment of tumors located close to the body's surface. We must take into consideration that while wet packing, for example, there is a significant decrease in deconcentration locally, but after finishing the cure, deconcentration will increase quickly, thus establishing favorable conditions for the tumor. This is why we suggest that one treatment should only last for a shorter time, 10 to 15 minutes, but it should be repeated 6 to 8 times a day. Local treatment should coincide with the consumption of DD water. 9. Sensitivity of the tumor to deuterium depletion. While establishing the dose, we must take into consideration that for the treatment of more responsive tumors, In the beginning, it is enough for the patient to drink DD water of about 90 ppm concentration, whereas patients with less responsive tumors will have to be dosed initially with DD water of a lower D content, with resistant tumors and those of a lesser sensitivity. Our suggestion is the consumption 55 to 60 parts per million DD water. Cancer of the pancreas, late-stage melanoma, and various types of sarcoma belong to this category. 10. Treatment of primary tumors and or metastases. It can generally be stated that primary tumors are responsive to DD water and their metastases are sensitive as well. When establishing the dosage, we can base the dosage on the mass of the tumor. This mass is significant if metastases have already appeared. It is obvious that the genetic heterogeneity of the tumor is also decisive, as it may lead to a resistance to deuterium depletion. Significant differences in behavior were found between the primary tumor and its metastases. 90. According to our observations, the liver metastasis of breast tumor is more responsive to DD water treatment than the primary tumor itself. The metastasis in the lungs can also be sensitive, but here a longer time is needed to obtain a favorable effect, 8 to 10 months, while in the liver total regression occurred within 1 to 2 months. We have to mention that the primary tumor of the gallbladder was, in 2 cases, responsive to treatment, while the metastases in the liver remained resistant. 11. The stage of illness of the patient at the beginning of the treatment. Earlier the DD water was applied, the better the chances the patient had and the more successful the results. Thus, we can draw the conclusion that it would show very good results if patients after a successful operation or chemotherapy could receive DD water as post-operative treatment. Because when the number of still existent tumor cells is the smallest in the body, DD water treatment could significantly decrease the appearance of new tumors, recidiva metastases. 12. The patient's general physical state. The patient's physical state is satisfactory. It does not affect dosage. With a patient, however, whose physical state is deteriorated, a subjective further deterioration may occur. After starting the treatment with DD water, the patient becomes more prostrate, depressed, and fatigable. This does not mean a general progression of the illness, but it is a consequence of the necrotizing tumor. This period can last from 1 to 2 weeks to some months. It is advisable to discuss the possible consequences of the treatment with the patient in advance. 13. Other treatments. The majority of patients involved in the treatment with DD water received conventional treatment as well. There were some exceptions, with patients who had used all the possibilities of conventional treatment or had never started any. Generally, DD water did not interfere with any conventional treatment. This, however, may not be true inversely, because the side effects of conventional treatment have several times impaired the effect of DD water. In the present state of the registration procedure, however, it must be accepted that the 2 treatments go together. Chemotherapy may especially deteriorate the effect of DD water treatment if, because of side effects, the patient is unable to consume liquid for several days. However, in several cases, patients consuming DD water tolerated cytostatic treatment better. Their blood count had not deteriorated, and other side effects did not occur as much as expected. Therefore, the establishment of the dosage should not be influenced by the applied cytostatic and radiotherapeutic procedure. Following surgery, the dose of DD water must be decreased by 60 to 70% for 6 to 8 days. We have observed that in some cases DD water slowed down the process of wound healing. We note, however, that in many cases we did not experience the above. Decreasing the dose for some days after the operation is thus indicated as a precaution. 14. The blood count of the patient. Direct examinations concerning the relation of the patient's immunological state and the drinking of DD water have not been performed, but on the basis of general experience, the recovery rate is better with patients having a normal white blood cell count than with those having a deteriorated blood count caused by cytostatic treatment. One of our patients with lung cancer had been treated conventionally for several months, and as a result of this, the illness came to a state of stagnation. Regression was seen only months after the cytostatic treatment had been finished. The drinking of DD water did not essentially influence blood counts of the patients, but with patients receiving chemotherapy, blood counts became even better than expected. 15. Time passing since the beginning of the application of DD water. At a more advanced stage of treatment, the amount of DD water should be increased and/or the administering water of a lower D concentration should start. The more time passes from the beginning of the cure, the lower the D concentration in the body. Time passing also means that part of the cells inside the tumor have spent a longer time in a medium of lower D concentration and were enabled to adapt slowly. If a certain time has already passed, this can be from some months to 5 years, and it is not possible to obtain any more decrease in D concentration. The tumor may make further progression. This is the case of patients whose total regression could not be achieved with DD water. The opposite of this, however, can also happen. When D concentration in the patient's body can no longer be decreased, there still occurs a significant improvement. The explanation for this might be that D concentration kept much lower than natural also gives improvement, as tumorous cells get exhausted in this medium. Based on our experiences, patients who have become free of the tumor after a treatment of DD water can feel safer if they consume DD water for an additional year. Of course, the longer the duration of the remission, the more we can hope to achieve complete healing. The first attempt to stop or interrupt the cure, we suggest doing it gradually. The duration of the deprivation should be 1.52 months. It is definitely suggested to repeat the cure after a pause of 2 to 3 months. In case of a repeated protocol, first we suggest a quick decrease in the concentration for 4 to 6 months, followed by a slow cessation. Then a 4 to 5 months break again is recommended, followed by another 2 to 3 months treatment, which can also be repeated.